Hello, I'm Dr. Rakhi Gupta. I'm a gynecologist. I practice in South Delhi. Let us discuss a little about recurrent abortions. Recurrent abortion, which we also call medically as recurrent pregnancy loss, RPL. So repeated miscarriages are seen quite commonly these days, and it occurs in approximately 7.6% of the pregnant population. We can categorize it into early miscarriages occurring below 12 weeks of gestation, or it can occur between 12 to 20 weeks of gestation, or what we define as stillbirth can occur over 20 weeks of gestation. So often we see that 20% of the pregnancies land up into spontaneous abortion. This is usually genetic in nature, and the fetus which is being formed cannot thrive, and so it is either there is a missed abortion, or the cardiac activity doesn't appear, or it comes and it goes away. But it does not necessitate that in subsequent pregnancies the lady is going to suffer from the same problem. The next pregnancies may be normal. But if such kind of thing occurs twice or thrice, then it becomes necessary for us to check that what is the underlying reason for such kind of problems. The reasons may be multiple. There may be a structural defect in the uterine cavity which causes repeated abortion. There may be certain infections such as TOJ group of infection. TOJ group means Toxoplasma, Rubella, Cytomegalovirus and herpes infection, because of which the fetus gets infected and it is aborted. It may be because of generalized maternal disorders such as tuberculosis or endometritis, poor nutritional status, uncontrolled diabetes, or thyroid disorders, uncontrolled hypertension, etc. So again, now when we look up into the reasons back into it, we also look for autoimmune problems. Autoimmunity plays an important role, and what we call is antiphospholipid antibody syndrome, in which the mother starts producing antibodies against its own fetus and it is rejected from the body. This is quite commonly seen, and it needs investigation and treatment as well for the same thing. So considering all these multiple factors, the lady has to be investigated and treated according to her dysfunction. Often it is nothing to be disheartened about, and we are successful in treating such kind of cases and giving positive results. So we have to always ensure that we are getting the lady investigated from a good lab which is NABL accredited and PCPNDT approved. Thank you.